Hello, I am Abigail Garcia with the Indiana State Office of Rural Health. I manage this office, which is housed at the Indiana State Department of Health within the Division of Chronic Disease, Primary Care, and Rural Health. The Indiana State Office of Rural Health is funded through a grant through the Health Resources Services Administration's Federal Office of Rural Health Policy. There is a State Office of Rural Health in all 50 states. The SOAR was created to help each state's rural communities build capacity and improve their healthcare delivery systems. Every state SOAR operates quite differently because the rural landscape across the country varies, the health needs of rural citizens are complex, and state priorities are often tailored to specific efforts. As I move through this presentation, you will learn how Indiana's SOAR operates, the grant programs that are managed within the office, and how the SOAR can be a resource to your community. The following grant programs are administered and managed under the umbrella of the State Office of Rural Health. First, the State Office of Rural Health grant funds the establishment of the SOAR, as well as provides funding for a variety of things among all 50 states funded. There's a saying within the rural health community that once you've seen a State Office of Rural Health, you've seen one, which means that all SOARs have unique needs within their states and are able to use the funding provided through SOAR to address those unique needs. In a few slides, you'll be able to see how Indiana has been using that funding in the past and how we've decided to use it going forward. Secondly, the Small Rural Hospital Improvement Grant Program, otherwise known as SHIP, is administered and managed through the State Office of Rural Health as well. These grant funds have traditionally been small individual grants to eligible hospitals to obtain training or education, purchase equipment, and/or implement processes and categories aimed at improving patient care. Soon I'll share how we've updated and transitioned that grant program into a collaboration with the Indiana Hospital Association. Thirdly, SOAR is responsible for the oversight of the FLEX program for critical access hospitals. These grant funds have been used to provide quality improvement education and develop targeted initiatives across the state through a number of expert consultants in areas of quality improvement, financial and operational improvement, and leadership development. The State Office of Rural Health has five core functions outlined for you here. First, the office is responsible for making sure the rural providers around the state have pertinent and timely information regarding a variety of things, such as funding opportunities, policy and legislative changes, upcoming events, training and educational opportunities, and more. Secondly, there is a lot going on in rural health in Indiana. In order to avoid duplicating services and opportunities, the State Office of Rural Health is responsible for coordinating those efforts across the state. Thirdly, we are here to provide technical assistance to anyone who is serving rural Hoosiers. That could include nonprofits and other agencies such as Area Agencies on Aging, WIC agencies, Healthy Families Programs, First Steps, and more. There are a lot of opportunities for learning and funding at the federal and state level, and it is helpful to have someone at ISDH who can point rural service providers in the right direction. The State Office of Rural Health also works hard to develop new partnerships, whether that is within the State Department of Health, in departments such as Maternal and Child Health, the Department of Nutrition and Physical Activity, or the HIV and STD Division, as well as outside our agency, such as our partnership with OCRA and the Hospital Association, in an effort to build a more collaborative rural health focus. Finally, there are several shortage areas happening across the state of Indiana right now when it comes to healthcare professionals serving in rural settings. We actively promote, through a variety of partnerships, recruitment and retention efforts, which help place providers in the appropriate setting to serve rural Hoosiers. The State Office of Rural Health has funded the following projects over the last 2 years. The first was with the Rural Health Innovation Collaborative, and they provided a comprehensive needs and knowledge assessment to emergency department staff of rural EDs to see how they were approaching opiate use and abuse and overdoses in their emergency departments. Once they compiled the findings and identified gaps in knowledge about substance use and abuse, the Rural Health Innovation Collaborative offered a free one-day symposium to increase knowledge and close those gaps. The second project was through IU's AHEC system, and their project was designed to increase the opportunities for students who are pursuing a career in mental health and substance abuse disorder to get valuable clinical experience in rural settings. First, a needs assessment was completed to see what barriers existed to these opportunities. Next, the project looked into developing more partnerships with rural providers, removing those identified barriers, and increasing the access to those opportunities. We know that when students serve internships and do clinical experiences in rural settings, they are more likely to continue practicing in rural areas. We believe this work can continue by providing the liaison through the State Office of Rural Health to be connecting rural health care providers to the students involved within their prospective AHEC regional office. As the federal requirements of the HRSA funding look more toward value and community impact, we believe that it is important to connect to existing agencies that are offering community-based programs, projects, funding, and capacity building. OKRA is doing that through their Stellar Designation Program, which helps small rural communities with economic development grants and projects. These projects range from housing, roads, and historic preservation to complete streets and trail systems, funded through a variety of partners. While all of those things contribute to good things for residents of those communities, health had not been a primary focus of project development and implementation. We are changing that this year by funding the 2 Stellar awardees with $37,500 each to plan, develop, and implement a rural community health project. SOAR will provide technical assistance to each of the listed 6 current finalists as they develop their regional plans, which will include the Rural Health Project. Communities will be asked during this time to look at a community health needs assessment, either through a critical access hospital in their area or their local public health department, or other critical health data to identify where there are needs, gaps in service, or opportunities to improve health. Once the project is implemented, community leaders will be required to report on specific measures that show community health improvement in their area over the 4-year Stellar program period. We look forward to sharing highlights, challenges, and lessons learned from this new partnership, as well as provide technical assistance to rural communities on topics such as collaboration, capacity building, project development, and more. The SHIP grant provides critical access hospitals and small rural hospitals with training and educational opportunities through a new partnership with the Indiana Hospital Association. This is the first year that this collaboration has been part of the SHIP program, and the following projects were developed through this partnership. The first project is a Rural Health Clinic Quality Measures Education Project, and the goal of this project is to lead and promote quality improvement activities for rural health clinics and any clinics associated with a SHIP-eligible hospital, including but not limited to metrics training, support systems implementation, revenue cycle management analysis, and training for process improvement, and practice transformation activities such as patient-centered medical home development. These training opportunities will be provided for rural health clinics to learn about various quality improvement activities, including looking at opioid prescribing habits, chronic disease management, and education on treating diabetes and asthma. There will be one-on-one technical assistance offered for improving the revenue cycle, and an opportunity for critical access hospitals that do not have rural health clinics currently to explore the benefits of what having a clinic would mean and how they can contribute to the hospital's bottom line. The educational opportunities will be based on the needs assessments conducted through this project on the healthcare needs of those clinics. The technical assistance will work in collaboration with the Purdue Healthcare Advisors identified lean projects to continue to build upon the needs identified through the lean assessment. The second project is going to be focused on sepsis and improving recognition, early treatment, and education. The goal of this project is to provide cost-effective training and education to aid the participating hospitals and their staff to promptly recognize and comply with evidence-based treatment protocols to decreasing sepsis-related mortality. The objective of the project will be to increase staff knowledge to promptly recognize sepsis and effectively communicate among the clinical team. We hope they'll learn to formulate a plan to leverage staff knowledge and utilize their EMRs and the technology they have to trigger treatment alerts. Also, we hope to analyze sepsis cases via root cause investigation to identify where gaps in early recognition and appropriate treatment exist to improve system defects. Participating hospitals will complete a survey serving as a gap analysis to identify where potential or actual system failures exist regarding this early recognition and compliance with the surviving sepsis 3-hour bundle elements. Hospitals will be provided training opportunities, which will include learning modules and case studies, as well as root cause analysis to improve effectiveness of case investigation and to identify the impact of actions or failure to act which influence patient outcomes. The third project is a de-escalation training and crisis prevention and intervention techniques for hospitals. The goal of this project is to provide the training and education to help staff safely diffuse anxious, hostile, or violent behavior with crisis prevention and intervention strategies. The objectives of the project will be to increase staff knowledge to promptly recognize signs of potential crisis related to opioid misuse and dependence, and provide training on how to respond to drug-seeking individuals and other hostile patients and families. We want them to identify best practices from peers through a multidisciplinary in-person collaborative and implement those lessons learned from training and the in-person collaborative within their prospective hospitals. Participants will join an introductory webinar giving a framework for the training and tips for identifying champions and having a successful initiative. De-escalation training, such as nonviolent crisis intervention training, will be offered during this project, and additionally, participants will come together to learn from experts and peers. This event may include a speaker on resilience, a multidisciplinary panel discussion, and table discussions about successes and lessons learned. The fourth project is improving care transitions among multiple care providers in rural areas. The goal of this project is to provide training and tools for these hospitals that are participating, a long-term care facility in their area, and their EMS staff to support transportation and care transitions for patients with chronic disease, such as COPD, through shared accountability and improved communication. Participating hospitals will be asked to include one skilled nursing facility and EMS provider to join this project by attending a kickoff webinar, participating in safety culture assessments, and attending an in-person patient safety forum to promote communication of transfer of high-risk patients and to educate on chronic care management for respiratory compromise and COPD. Communication and educational methods will be based on CUSP and Team STEPS methodology. Participants will have opportunities for peer-to-peer communication platform for ongoing resources and events such as webinars. The final two projects are going to be related to finance and operational training. The first is a training and education related to ICD-10, and the goal of this project is to provide cost-effective training and education for participating hospital staff to help ensure compliance under changing compliance requirements. Key focus areas for claims selection will include ICD-10 diagnosis coding compliance for the following: opioid and substance use, abuse, and dependence, chronic disease management for congestive heart failure, chronic obstructive pulmonary disease, asthma, and diabetes, sepsis, and tobacco use, abuse, and dependence. A sample of participating hospitals will be invited to participate in an audit of a selection of inpatient and outpatient records for ICD-10 documentation and coding compliance. Hospitals will receive individual results, analytics, and recommendations. Additionally, all participants will respond to an online survey which will inquire about current coding operations, productivity, and other key performance indicators. Educational offerings will be provided for all participating hospitals. This project will build upon areas and results of the 2017-18 carryovership projects focused on similar efforts. The final project is an IRS 501R Additional Requirements for Charitable Hospitals project. The goal of this project is to offer a cost-effective review for participating hospitals to ensure compliance with IRS subsection 501R, Additional Requirements for Charitable Hospitals. As part of this project, participating hospitals will receive a review of their hospital's policies for the significant aspects of the rule, such as amounts generally billed calculations, providing care through hospital-owned facilities, extraordinary collections actions, and the plain language summary. Participants will receive a written report of the assessment of their policies and procedures in relation to the regulations of 501R. This includes recommendations to the hospital in order to ensure compliance with the recommendations. There are 44 eligible hospitals in Indiana for this grant program, and each hospital was able to choose between the 6 projects being offered during the year and will form into project-specific cohorts for training, capacity building, and resource discovery. The Indiana Hospital Association will report measures back to the State Office of Rural Health, and feedback surveys will be sent out to participating hospitals in order to develop future projects, highlight successes, and address any challenges that the hospital teams experience. The FLEX program was established from the Balanced Budget Act of 1997 to assist rural hospitals and improve access to care through critical access hospital designation. The FLEX funding initially provided funding to state offices of rural health for designation of critical access hospitals in rural communities. With all eligible critical access hospitals having been converted, the FLEX program now assists those hospitals with quality and performance improvement activities, stabilizing hospital finances, and integrating emergency medical services into healthcare systems. Particularly for Indiana, our FLEX program provides critical access hospitals with training and educational opportunities through several contracts focused on quality improvement. The current grant cycle has contracted with the following vendors to provide the QI work. The first contract that the FLEX program works through is with Valiant Health, and Becky Royer with Valiant Health has been contracted under the FLEX grant to provide technical assistance to critical access hospitals in reporting on required measures within the Medicare Beneficiary Quality Improvement Program, otherwise known as MBQIP. The measures include 4 domains. Those are patient safety, patient engagement, care transitions, and outpatient care. Becky provides online and in-person group learning education, one-on-one training to quality staff members, as well as coordinating and developing specialized work geared towards helping improve patient care and quality. In addition, Becky provides an opportunity for critical access hospitals to come together in a convening meeting twice a year, offering education and valuable networking opportunities for the 35 hospitals in Indiana. Those meetings include topics that are specific to the needs of Indiana critical access hospitals and rural communities, and the meetings provide an opportunity for sharing best practices. This year, Becky will also provide education and training for new quality staff on quality improvement and hospital reporting in an effort to address and reduce hospital staff turnover. The second contract we have through FLEX is with Burroughs Consulting. Elizabeth Burroughs provides a formative evaluation of the FLEX program by evaluating the effectiveness and efficiency of the FLEX program through analyzing the funded projects for each grant year and makes recommendations for the future success of the FLEX program. Elizabeth does this through a variety of analyses, including satisfaction surveys, developing and revising data collections instruments, reviewing collected data, and reviewing and implementing strategic plans for improvement. In addition, this year, Elizabeth will offer program consultation services to rural health clinics that are attached to critical access hospitals in chronic care management and integrated behavioral health into the primary care setting. The third contract that is offered through the FLEX program is with Purdue Healthcare Advisors, and over the last 4 years, PHA has offered a lean training program for critical access hospitals throughout the state. The goal of this project is to build organizational structure and support that encourages, requests, and requires project initiatives that improve quality, lower costs, and aligns with organizational goals. That happens through a couple of different things. First, they offer leadership training, and that is in terms of value stream management, operational excellence, aligning improvements, and strategic planning. Secondly, they build improvement capacity through the use of champions, and so individuals go through Lean Six Sigma, Yellow, and Green Belt certifications and project coaching. Thirdly, they encourage collaboration and connectivity among the critical access hospitals. And this year, Purdue Health Advisors is building upon the last 3 years of work and offering additional training for more advanced practitioners within the Lean framework for hospitals previously part of the original cohort, as well as providing the Lean training program to a new cohort of hospitals who have not previously participated. Finally, the Flex Grant funds some of the initiatives through the Indiana Rural Health Association, and IRHA contracts with the Flex program to host symposiums and an annual conference for critical access hospital staff and leadership to encourage networking and share best practices, as well as hosting virtual meetings monthly. The symposiums focus on hospital operations, quality measures, hospital leadership, and revenue cycle management. In addition, IRHA is an integral partner in all things rural health and serves as a collaborative partner in each of the State Office of Rural Health grant programs. The SOAR is available as part of its core functions to assist rural providers and communities to understand the opportunities out there and help build capacity to take advantage of those opportunities. It's important that the SOAR knows the projects around the state that are improving health in rural areas so that those projects can be followed, shared, and integrated across not just the state of Indiana, but in other states as well. SOAR can help in any of the following areas for rural communities who are looking for opportunities to improve health. I have reviewed grant applications and proposals at the state level, and I'm an approved HRSA grant reviewer as well. In addition to sharing funding opportunities with rural communities, I am also available to look over any rural-centered grant proposal in order to provide feedback. In addition, I'm happy to assist in any technical assistance way that I can. I'm happy to help as your community seeks out opportunities for funding, data as far as collection, review, and analysis, building capacity, which includes new partnerships, memorandums of understanding, and collaborative efforts, and more. Communities should know what their baseline landscape of health looks like in order to know how to improve and identify where gaps exist. So the SOAR can help sort through all the collection efforts already being made, such as community health needs assessments or hospital discharge data. Throughout the year, the State Office of Rural Health meets with national partners to discuss the state of rural health and learn about projects and programs that are innovative and working around the country. It's important to SOAR that we don't reinvent the wheel each time, but instead utilize projects and programs that are already showing positive signs of improvement for rural health. There are many great solutions, toolkits, best practices, and promising projects happening in other states that are certainly adaptable to the needs in Indiana. As there is always work being done in rural health in Indiana and across the nation, SOAR, as well as its many rural health partners, are responsible for sharing valuable and pertinent information about that work. This includes legislative and policy change that affects rural communities, as well as national trends and innovative solutions directly impacting rural health. We've all heard about silos and how easy it is to get into a mode of putting our heads down and getting our work done. It's a challenge to look outside your agency to find partnerships and collaborate in ways that are innovative and non-traditional. However, it is an important step in addressing the needs that rural Hoosiers have and providing access to the available resources within the community. The new Stellar Regional approach is an example of how rural communities should be leaning on each other in ways that may not have been done previously. Good health is foundational for rural communities in Indiana, and it's important to remember that we all have a part to play in improving health. Developing partnerships and building a collaborative culture within our rural communities is a step in the right direction. I've listed here on this slide some of the national resources that the State Office of Rural Health uses on a regular basis. I use the RHI Hub fairly regularly, almost daily, to look at funding opportunities, to help communities figure out what definition of rural they meet, if any. There are lots of toolkits available on a variety of topics that are relevant to rural health. And then they offer a data explorer, which gives some really good information about particular health data collection efforts. The second is a National Rural Health Task Center that helps us look at different toolkits. They offer webinars regularly and give us in our state office technical assistance that we can then provide to rural communities. The third listed here is the community guide, which gives some really good evidence-based resources for communities to address health issues. It's not always rural centered, but there are good things, good resources on that community guide. And then we also use some state and local resources. So as I said previously, the Indiana Rural Health Association is just one of our integral partners at the State Office of Rural Health. They hold their annual conference, various symposiums, and then monthly webinars. They are experts in telehealth, network development, advocacy, and much, much more. They are a valuable resource to us in Indiana. The Indiana Hospital Association is also one of our most trusted partners. They offer a variety of resources and are experts in areas of patient safety, advocacy, and data services. And lastly, listed here is the Alliance for a Healthier Indiana. They do provide some county level data, and then they have, as their charge, chosen these 4 priority issues: obesity, infant mortality, tobacco, and opioid use to focus their efforts on. I would encourage you to go to all of those sites and explore, and my contact information is listed below. If there's any way that we can provide technical assistance for you in any way, please reach out to our office. We'd be happy to help. Thanks so much.